So let's dive into it. Our session will be on Trichuriasis and Enterobius vermicularis. These are intestinal parasites. So today the objectives will be to help you understand what are these parasites and what do they do to you, and how can you treat them, and what are the control measures to prevent your patients and yourselves from getting these infections. And these are quite common together because so let's say Trichuriasis is also known as the whipworm, and whip is that normal known as a weapon, a whip. The disease that Trichuria causes is called Trichuriasis, and most common location of Trichuriasis is the lumen of the cecum, as if you remember, these are intestinal parasites. It may also be present in the appendix or the rectum or the upper colon with the thin anterior end embedded into the mucosa. I will show you the image of this so you can appreciate it in a moment. So Trichuriasis is in the phylum Nematoda, among the Phasmidia, family Trichuridae, and genus Trichuris, and the name is Trichuriasis trichuria. So the morphology, males and females are slightly different in terms of the morphology, but the size is an average of 3 to 4.5 centimeters long, or 30 to 45 millimeters long. And it resembles a whip, which has a very thin hair-like anterior portion and the thick, stout posterior portion, like the handle of a whip. And for males, the back end is tightly coiled, and it has a single spicule. Spicule is like a penis that is used, is only available for male nematodes, that is used for sexual reproduction. So this is a morphology of a male Trichuriasis. You can see this is the tail end, and then the thin end is the front end. It's quite counterintuitive. And you could see these are the reproductive organs for the male, and this part here, the carved end, as is seen in male, that this is where the spicule is, and you could get to see a close-up here. This is a spicule that is used for reproductive purposes. Going on the morphology of the females, they are slightly longer than the males, which about 30 to 50 millimeters long, and they also resemble a whip. Very thin hair-like anterior, and then thick, stout posterior portion, the hand of the whip. But the difference between these ones and males, the female's posterior end is not as coiled as the male posterior end. So our posterior half is preoccupied with stouts of uterus and packed with eggs. You can see this as a difference. So if such a question comes in an exam, you'll be able to differentiate between males and females. These would be the female, and the ones that are coiled would be the males. And remember, this is the head, the front end. This is the front end, and this is the posterior end. And you can see these are the eggs. The posterior end of the female, it's saturated with a lot of eggs. So this is the reproductive component. And the eggs now, there's a yellowish brown bile-stained eggs with have a size of 50 to 25 micrometers in size, and they're barrel-shaped, and they are very typical because you cannot miss the eggs of Trichuriasis once you've seen them. They have a colorless mucus plugs at the both ends, and they are segmented when freshly passed in stool. And they're usually not immediately infective, the eggs, when they're passed in stool. So these are the eggs, the beautiful eggs of Trichuriasis. You can see they have very shiny mucus plugs that is colorless, and they are like barrel shaped with a double end mucus plugs. So these are the eggs of Trichuriasis. And this is another to show you the eggshell and the embryonic cell. And this is an unembryonated egg once it comes out from fresh stool. So the life cycle of the Trichuriasis is quite direct life cycle in terms of you get infected by ingesting the eggs, and then they get into your intestines, and then they would settle within the cecum and the appendix area. They would mature, and then after the larva has hatched, actually in the small intestine, they get to migrate to the large intestine, and they stay there and they start to establish themselves there. And I'll show you an image of how the females would be embedding themselves into the mucosa, part of the mucus, and then the other part of the posterior end will be outside. And then they will lay the eggs, a lot of eggs, and then these eggs will be passed out through stools as unembryonated eggs. And then this is a diagnostic stage. So you would diagnose using stool samples. And then the eggs will start to embryonate and form two-cell stage, and then they get cleavage, and then they'll the embryonated eggs that are infected will get ingested, and then the life cycle continues. So it's a very rather direct life cycle. And so unembryonated eggs are passed with the stools. In the soil now, the eggs develop into a two-cell stage, as you've seen, and they undergo the advanced cleavage, and they need to become infective after being incubated for up to 1 month. So this is very important when it comes to infective stages and control, to get to know when does this parasite gets to be infected. So when someone gets infected, it means has been exposed to these parasites that have been around for over the months. So after ingestion, the soil-contaminated eggs hatch into small intestines, as I've mentioned, and they mature to establish themselves in the colon, and they're usually approximately 4 centimeters in length. Now, adult worms are fixated in that location, and then the females start to lay eggs between 60 to 70 days after infection. So this means, this is very, very important point when you're looking at diagnosis of this parasite. Because upon laying of eggs, which is after 60 to 70 days, it means someone who has traveled or has not been returned back from traveling immediately, you would check them and they would not be able to find the eggs of Trichuriasis trichiura in the stool. So usually a good time would be after a few months, 2 months of returning from travels. And then the eggs usually are between 3,000 and 20,000 eggs per day. This number looks big, but it's important to remember this number later for comparison. So this is an example of another Trichuriasis, but this is Trichuriasis muris. This is for research purposes. It can be used for infection in mice, demonstrating how they would infect. I'll orient you how this is it. So this, what you see here, this structure, this is the posterior end that is thicker. And then you can see here, this is a section where the eggs are coming out. Eggs are coming out through this part. And then the whip, the long part, is embedded inside the mucosa, epithelial mucosa here of the intestines. So this is where they're being deposited. This is a sample scanning electron micrograph of for mice that is infected. And this video shows you the endoscopy that has been done in an adult human being, and it shows the parasite in situ. So let's see. Just a second. So you would see this parasite is in situ here, and it is embedded. Let me pause it here for you to see. This is the outside posterior end, and the inside has been embedded inside the mucosa, goes all the way there. So this is an endoscopic, they're trying to shake it to see how it looks. You can see clearly that it is, when it's sprayed with water, it's just firmly attached within the anterior end, is embedded in the mucosa, and the posterior end is outside and it keeps laying eggs. This parasite, once it's in there, it feeds on the tissue of this human being that is infested. So when you're talking about the pathogenesis, this is strongly related to the size of the worm burden in terms of the number of worms. And if you have fewer worms, we are confined to the cecum and the ascending colon. There's usually little damage, and you might not be able to see any symptoms. But in heavy infections, where they would spread throughout the colon up until the rectum, they cause hemorrhages and mucopurulent stools, and sometimes symptoms of dysentery with rectal prolapse. Now, why would someone get rectal prolapse, and you see an image of a rectal prolapse like that? Is because these parasites, once they have embedded the mucosa, they cause some edematous swelling, and this the swelling of the mucosa makes you feel as if you have urge to defecate. It feels like you have feces to push out, so you tend to want to push more every time. You want to push, and also the parasite itself weakens the walls of the rectum in such a way that every time you want to push, it just prolapse and goes out. It is very uncomfortable. But you can also, you'll be able to, in a person with rectal prolapse, you'll be able to see some whipworms that are embedded in the mucosa. This is in a case where you have very, very heavy worm burden, and you can see this parasites in this person. So again, so it causes sometimes Trichuriasis dysentery syndrome, where when you have heavy infections, when you have light infections, this is important to remember. When you have light infections, which are normally light infections, you would not have any blood in the stool that you have. Anterior portion of the worm and the mucosa cause small foci, and then they will cause some bleeding and ulceration that would tend to give you bloody stools, which is dysentery syndrome. And this predisposes also the host to other amoebic dysentery, because you already have damages in the mucosa, and the spreads of other enterobacteria such as Shigellas and things like that. So this is a complication related to trichuriasis. And worms in the appendix may cause appendicitis, and continuous straining leads to increased peristalsis, again leads to rectal prolapse. So that's very not good. So how do you diagnose this? You could diagnose this by direct microscopy, where you recover the characteristic eggs from saline fecal emulsions, where you collect stool samples. And this there are techniques, like a technique known as Cato cuts. It's another useful technique for you to know. I'll mention about it later. And also occasionally, if you recover adult swarm in the feces, especially when there's heavy infection. This is or during sigmoidoscopy, like the video I just showed you in the past few minutes. So again, so this is a Cato-Cats method that is recommended by the WHO, where you have to see there's barrel-shaped eggs with 2 terminal polar plugs. A Cato-Cats technique, so what you do, you take a stool sample, you put it in a slide, and then you press it, and then you look underneath the slide to see the existence of the eggs. So eggshells, this is another description of the number of layers it has to be able to identify. And a heavy infection for this is defined as more than 10,000 eggs per gram of feces. So this is another factor. Could do proctoscopy, increases in cases of dysentery. You will show numerous worms that attach to the mucosa, which is reddened and ulcerated, whether they are responsible for dysentery. You could do radiology, where you have honeycomb appearance of the intestines, which has been linked with the appearance of the Crohn's disease. This is interesting that there are studies that have shown when people are infected with these parasites, they tend to get better if they have bowel inflammatory disease such as Crohn's disease. So this is quite counterintuitive, and people have done research to use these intestinal parasites as treatment for Crohn's disease or inflammatory bowel syndromes, because there is a tendency to get better at it. You could do more Google and see the research papers that are related to that. Deformity of the intestine is mostly marked in the proximal colon, but also present in the ileum and appendix. Treatment, you could use mebendazole or albendazole. These are drug of choice. Mebendazole is mostly superior to albendazole in this case. So if you were to choose, you would rather choose mebendazole than albendazole to begin with. But albendazole will be ideal for mass chemotherapy because you give it only in a single dose. And the epidemiology, this is typically a fecal-oral disease. When you eat feces, which is, if you have trichuriasis, that means you have basically eaten feces. Where fecal contamination of the environment occurs, the disease occurs in areas of high rainfall, high humidity, a dense shade with poor sanitation, and as contaminated soil in the tropics. So, such as ascaris. And it's important to note here that this is also known as a geohelminth. And among the geohelminth, there are three, which is called unholy trinity, because there's ascariasis, the hookworms, and the Trichuriasis. So these are the categorized as geohelminths, which are in the soil. Geo is soil contaminated. And prevalence is high in primary school children who develop heavy warm burdens and pollute the soil around the house as a result of improper fecal disposal. And trichuriasis is also common in areas where human feces are used as fertilizer, as night soil for salad and vegetable gardens. Countries like India are very popular in using human feces as fertilizers. So this is an important thing to take note while you're treating these feces. And control personal hygiene. Make sure that you use the toilet. Human disposal of feces, proper use of latrines in all household members, hand your wash before and after meals so that you don't eat feces, but also hygienic measures in handling food and vegetables. There are people who buy vegetables in places where the water that is used also water from the toilet. This is risky, so you need to make sure you cook your vegetables well, you wash your fruits before eating them, and boil the drinking water. Again, in Tanzania, we still have campaigns of Nyumba ni Choo, so construction of proper fecal disposal facilities and safe water supplies, health education, and awareness campaigns to promote community participation in periodic of the deworming of children and mass chemotherapy. Great, so this is the first part, and if you have any questions, this is your time. Let me know before we get to the second part of Enterobius vermicularis.